Good morning, breathers. So the purpose of this short little video is the amazing practice, the free practice of nasal diaphragmatic breathing. You can naturally lower your blood pressure. You can oxygenate your brain and oxygenate your heart more easily, readily with nasal diaphragmatic breathing. So how do you do that? How does that even work? Well, Christian Bohr discovered that in the presence of carbon dioxide, hemoglobin releases its strong hold on oxygen, thereby releasing the oxygen from your blood to go from your hemoglobin to go into your muscles and your brains. A nice point made by Dr. George Dallin. It's like Dallas, but with an N at the end. Or no, with an M. It's a weird name, Dallin. And Patrick McEwen. They talk about the effect of slow, low, light breathing, increasing our carbon dioxide. The reason we breathe is we have chemoreceptors in our brainstem that tell us we're getting some carbon dioxide. We need to breathe it out. But we can actually tolerate a lot more carbon dioxide than we're used to. We're kind of breathing a lot of it out, which we don't need to breathe that much out. So by lowering your breath, be breathing through your nose, light, slow, and deep, LSD, you're opening up all your blood vessels because you're increasing your carbon dioxide and your nitric oxide, which is produced in the nasal passages and in the blood vessels. These are vasodilators. So we have these small blood vessels around our heart that when we blow out all of our carbon dioxide and have a high sugar carbohydrate diet, we're getting a lot of constriction. Getting a lot of constriction through our incorrect breathing and through our incorrect diet. And so what that does is, of course, constricts or narrows the blood vessels around all over our body, but particularly we're talking about around our heart and throughout our brains. So when that constricts, your heart has to pump harder. So it's a cycle. So you're constricting your blood vessels, and now your heart has to work harder, and now you're using more energy and getting less return because your blood vessels are constricted. So it's actually just the opposite. Once you learn and make it a habit of breathing slow through the nose, longer exhales, hold the exhale out for just a little bit. It's called breathe light to breathe right. Breathe in for 4 counts. Breathe out for 6. Just relax. Relax into it. Get comfortable with increasing your carbon dioxide tolerance. It's called high altitude training, but you don't have to go to the mountains. You do that and you get in the habit of doing that, of breathing low, slow, and deep. And you will attain more carbon dioxide. You will have your blood vessels will be more dilated. Your blood will flow more freely. You won't have those blockages in your heart as easily. You have to control your diet. You have to do a little exercising. The blood vessels in your brain will also be dilated to help get rid of all those protein plaques and things that accumulate. That's kind of been associated with dementia. So you can control your life with a simple tool of deciding to grab this powerful gift. There's a lot more anatomy we could go into about the nasal passages, the turbinates, the humidifying of the air, the pressurizing of the air, the purifying of the air through the carbon dioxide and nitric oxide. You put a pulse oximeter on and you're going to have, most people will have 95 to 99% peripheral blood oxygen saturation. And that's fine. But if it's not leaving the blood and going into your brain and your working cells, your working muscles, it's not doing what it should be doing. So practice your little breath holds, practice your nasal breathing, slow, light, slow and deep, and open up your blood vessels around your heart and in your brain. And remember, shut your mouth and save your life. Coach Couch out.